Hello everyone. So today we'll discuss about the pathology of liver cirrhosis. In my previous video we have discussed about the acute and the chronic hepatitis, and in that I told you that if the chronic hepatitis progresses and it is uncontrolled, it may lead to liver cirrhosis, and it is the end stage of liver damage or liver injury. It is the liver cirrhosis. So as you can see over here, this is the picture of the healthy liver, and over here the cirrhosis liver. So liver cirrhosis, it is secondary to the chronic injury which alters the normal lobular organization of the liver. So what you will see under a microscope of a liver cirrhosis slide. So first of all you will see the fibrous septa. Okay, so first of all you will see the bridging fibrous septa. Then over here the normal cells will be replaced by the fatty cells. So bridging fibrous septa and the fat cells are observed. Now in this lobule you will find necrosis. So necrosis of the lobule and also regenerative nodules are observed in the slide of a cirrhosis, of a liver cirrhosis. So what you will find? Bridging fibrosis, then the fatty cells, regenerative nodules and the necrosis over here. Now very important, the clinical features in the cirrhosis. So there are mainly three important clinical features, that is the portal hypertension, reduced detoxification and the decreased protein synthesis. So how the portal hypertension occurs? So because of the bridging fibrous septa, fatty cells and the necrosis of the lobules, portal hypertension is observed. And because of the necrosis in the liver, there is reduced detoxification, and because of this also there is decreased protein synthesis. Now what effects in the other parts of the body are seen because of these clinical features? So first of all, because of the portal hypertension, splenomegaly is observed, or we can say congestive splenomegaly is observed. Now as you can see over here, this is the normal spleen and this is the enlarged spleen. Now what causes the enlargement of the spleen? Because of the portal hypertension. Now as we know that the liver is connected to the spleen by the portal vein, and because of the congestion in the portal vein, because of the necrosis of the liver and also because of the fat deposition, there is congestion of the portal vein, and because of this congestion of the portal vein, congestive splenomegaly is observed, which leads to the enlargement of the spleen. Now next effect of the portal hypertension, it is the ascites. So there are three main reasons because of which the ascites occurs. That is a transduction of the fluid, salt and the water retention, and the splanchnic vasodilation. Now first of all, how does this portal hypertension causes the transduction of the fluid which leads to ascites? So as we know, in the liver cirrhosis there is reduced amount of protein synthesis by the liver, and because of this reduced amount of protein, that is albumin, there is reduced amount of albumin production by the liver, there is reduction in the oncotic pressure in the body, and because of the reduction in the oncotic pressure, there is transduction of the fluid seen, and which causes the ascites in the liver cirrhosis. This is the effect of the portal hypertension. Now second is the salt and water retention. Now just imagine how does this salt and water retention occurs. Of course in the body there is kidney, okay, which basically maintains the body fluid and the excretion of the fluid through the body. So of course there would be some kind of problem occurring in the kidney because of the liver cirrhosis. So as we know, the liver actually causes the aldosterone metabolism. But as over here the liver is damaged, the liver is injured, there is cirrhosis of the liver, there is reduced aldosterone metabolism. And because of this reduced aldosterone metabolism, more and more amount of aldosterone will be present in the body. And what does the aldosterone do? It causes the reabsorption and the retention of the salt and water, the sodium, salt and water in the body. And because of this, there is ascites seen. Now, another reason of this salt and water retention can be the transduction of the fluid. How? This transduction of the fluid causes the underfilling of the circulation. That means there will be less amount of fluid in the circulation. And because there is less amount of fluid in the circulation, what the body will do? The body will cause activation of the renin-angiotensin system. And because of this activation of this renin-angiotensin system, it causes the more and more release of the aldosterone, and which again affects the kidney, which causes the retention of the salt and water in the body. Also, another reason can be because of this underfilling, or we can say the less amount of fluid in the circulation, there will be reduced renal blood flow in the kidney, which again causes the salt and water retention. So let's discuss again what causes the salt and water retention in the body, which leads to ascites. So due to portal hypertension, what will happen? Three things occurs. Because of the increased aldosterone. Why the aldosterone is increasing in the body? Because in the liver there is liver cirrhosis. The liver is injured. So because of this, the aldosterone metabolism in the liver is not done, and because of this there is increased amount of aldosterone, which leads to sodium and the water retention in the body, which leads to ascites. The second reason can be activation of the renin-angiotensin system. Why? Because in the body there is underfilling of the circulation. That means that in the circulation there is less amount of water because of the transduction. So because of the transduction of the fluid over here, because of the transduction of the fluid, what will happen? There is activation of the renin-angiotensin system. Because in the body there is less amount of fluid. So to maintain the fluid, there is activation of the renin-angiotensin system, which leads to again increased amount of aldosterone in the body, which leads to salt and water retention. And third reason can be reduced blood flow to the kidney due to the underfilling of the circulation. There is less amount of fluid in the circulation because of the transduction of the fluid. And as because of this, there is less amount of blood flowing to the kidney, which leads to again salt and water retention by the body, by the kidney, to maintain the fluid. And the transduction of the fluid is due to, if you remember I told you, it is because of the reduced amount of protein, reduced amount of albumin formation by the liver, because the liver is damaged. And because of this there is decreased oncotic pressure in the body, which leads to transduction of the fluid. The third reason can be splanchnic vasodilation. Now how this splanchnic vasodilation is occurring? Now it can be due to the underfilling of the circulation, that means decreased amount of fluid in the circulation because of this transduction, or it may be due to the fluid formation which exceeds the lymph return. So these are the three reasons why the ascites occur in the portal hypertension. Now next is the portosystemic shunt, which is caused because of the portal hypertension. Now because of this hypertension, to bypass the hypertension, there is abnormal connection formed between the portal vascular system and the systemic circulation. So as you can see over here in the type B, what is happening? There is small collateral and the shunt formation over here. This is the portal vein coming from the liver. Okay, and this is the systemic circulation over here. So it is forming a shunt between the liver and the esophagus, which is leading to the esophageal varices. So now as because over here there is an abnormal connection between these two, what will happen? A portion of the toxins, proteins and the nutrients absorbed by the intestine will bypass the liver and are shunted directly into the systemic circulation. Now next example of it is the rectum hemorrhoids, or we can say the piles. Now next example of this portosystemic shunt, it is the caput medusae, which is formed because of the abdominal wall collateral formation in the portal hypertension because of the liver cirrhosis, just to bypass the hypertension. Now next is the hepatorenal syndrome. Now I'll make this diagram a bit easier for you. I told you before also that because over here the liver is damaged, the liver is directly impacting the kidney as well. How? Over here, because the liver is damaged, it is producing lesser amount of proteins in the body, which is leading to decreased amount of oncotic pressure, which is leading to transduction of the fluid. That means the fluid is getting into the tissues and there is less amount of fluid in the circulation. And as because there is less amount of fluid in the circulation, just to compensate the circulation, what the body is doing in response to that? Our body is activating the renin-angiotensin system, which is leading to increased amount of aldosterone in the body, which is leading to hyperaldosteronism. Also, because the liver is damaged, the liver is not able to metabolize the aldosterone, and as because of this, again there is hyperaldosterone seen in the body. And because of this hyperaldosteronism, what is happening? The kidney is pressurized to retain more and more amount of salt and water in the body, and because of this insufficient glomerular filtrate, there is kidney failure seen. Also, this splanchnic vasodilation is directly impacting the kidney as well. Now, in short, just remember that the kidney is affected by the liver cirrhosis by three means. First of all, because the liver is not metabolizing the aldosterone, there is increased amount of aldosterone in the body, which is leading to more and more retention of the salt and water, which is leading to the kidney failure because of the insufficient glomerular filtrate formation. Okay. Second thing, it is because of the activation of the renin-angiotensin system. Why? Because there is underfilling of the circulation. There is decreased amount of fluid in the circulation because of the transduction, which is again leading to the increment in the aldosterone, which is again leading to the same thing, kidney failure. And the third reason, it is the reduced blood flow. Why? Because over here, because of the transduction of the fluid, there is reduced amount of fluid in the circulation, which is leading to reduced amount of blood flowing to the kidney, which is again causing the kidney to retain more and more amount of salt and water, which is again causing the same. There is a kidney failure. So over here, secondary to the cirrhosis, it is the hepatorenal syndrome, or simply you can just understand this whole diagram as well. The next is the reduced detoxification. Now we all know, apart from the other important functions of the liver, this detoxification is one of the most important function of the liver. And what if the liver is damaged or liver is injured? So of course it will cause reduced detoxification of the toxins in the body, which will lead to increased amount of toxins. And now what will happen because of this reduced detoxification by the liver? So first of all, there is mental status change seen in the body. Now what is this GIF showing to you? It is the asterixis. Now asterixis, it is the neurological brain cell damage, which is because of the decreased detoxification by the liver. Now how this is causing? Because there is increased amount of ammonia in the body. What does the liver do? It causes the conversion of the ammonia to the liver by the Krebs cycle, right? But as because the liver is not able to function well, it will cause increased amount of serum ammonia. And because of this increased amount of serum ammonia, asterixis is seen. And this asterixis may lead to coma also. So very important, mental status change and disturbance is seen because of the liver cirrhosis. Now next effect of the reduced detoxification in the body by the liver, it is first of all the gynecomastia, then the spider angiomata, this, and the palmar erythema. Now also in the liver cirrhosis, there is hyperestrogenism seen in the body, which leads to gynecomastia in the males, spider angiomata, and the palmar erythema is seen in the liver cirrhosis because of the hyperestrogenism in the body. Now another one is the jaundice is also observed. Now next is the decreased protein synthesis by the liver. Next, because the liver is damaged, it will cause decreased amount of protein synthesis, and this will cause decrement in the oncotic pressure in the body, which will cause accumulation of the fluid in the extravascular compartment and decrement in the intravenous fluid. And so because of the decrement in the intravenous fluid in the body, it will cause activation of the renin-angiotensin system, and this will cause increment in the aldosterone in the body, which will cause retention of the fluid in the body, and this will lead to edema. So I told you before also that because of the hypoalbuminemia, what will happen? Decrement in the oncotic pressure in the body, which will cause fluid shifting to the extravascular compartment and decrement in the fluid in the intravascular compartment, and this will cause activation of the renin-angiotensin system, and this will ultimately cause the increment in the aldosterone and the salt and water retention, and this will cause edema. So these were the effects seen in the liver cirrhosis. So again, very important, remember the 4 important pathological changes observed in the liver cirrhosis. That is the bridging fibrous septa, which is very common in the liver fibrosis and liver cirrhosis. Then the fatty cells, regenerative nodules, and the necrosis of the liver lobules. So this was about the liver cirrhosis, which is the end stage liver damage after which the liver fails. So I hope you found this video helpful. Thank you so much.